morning, everyone. I am Dr. Baranikumar, a consultant urologist at Coimbatore. Today, I will be discussing to the viewers about a overactive bladder. The overactive bladder is not a disease as such. It is just a simple symptom complex where the patient feels that he has an urge to pass urine, he cannot control, he feels that if he doesn't pass, he'll leak urine. Very occasionally, the patient even leaks few drops of urine. This is not a disease process as such. It is just a symptoms because of some other condition which leads to this one. This usually the overactive bladder which occurs in little elderly age group or about 45 years. If you see the incidence of the symptom complex, usually about 10 to 20% of the population will be affected. Usually what they feel is they feel that they have to visit the restroom immediately. If they don't do it, they might leak urine. This is a typical symptoms which they present with. Occasionally people leak urine also. A few drops, they don't completely leak, a few drops. This has to be typical differentiated from what is called a stress incontinence, which usually old people will have. This stress incontinence is nothing but the patient leaks urine when he coughs or when he strains or when he laughs. Usually they'll leak only few drops of urine or they might leak a lot quantity of urine. This has to be typically differentiated between the overactive bladder where they have the urge to pass urine. They don't if they don't pass urine, they might feel that they leak urine. And what are the causes? If you see why the people develop this overactive bladder, is nothing but usually this occurs in age. Age is one of the factors. That doesn't mean that all elderly people will have overactivity. And other factor which may lead to overactivity is if the patient has any neurological illness like Parkinsonism or multiple sclerosis, or they have cerebral palsy or spinal cord injury, they might have overactive bladder. And especially in females or postmenopausal age group, they might have. It doesn't mean that every postmenopausal female will have overactivity, but postmenopausal age group is one of the predisposing factor. Other thing is in old age in males, a prostatic enlargement. The enlarged prostate, which usually blocks the urinary tract, they may have an overactive bladder. Or the patient who has infection, urinary tract infection, they might have overactive bladder. Some medications like diuretics, where they increase the urine output, where the urine gets filled by the bladder very fast. In old age group, they might have little overactivity, and antidepressant medication for psychiatric medication can lead to precipitation of overactivity. Other few dietary like caffeine, taking a lot of coffee, alcohol, and the spicy foods which intake or tea, they or aerated drinks, they might induce an overactivity because the bladder gets filled fast. They might have an urgency to pass urine, and these are the etiological factors which may lead to overactivity. How to identify these people? Usually, these people they present with the they may not tell a clear history. They might tell that they might have increased frequency, but you have to differentiate between the increased frequency and overactivity. Usually, these patients they will after emptying they will not be having a satisfaction that they might pass. They are completely emptied the bladder, despite you seeing your urinary, the residual will be very less. And these people, they usually have the tendency to go to the restroom, and they might have difficulty in their work places because they have to frequently visit the restrooms, or they may even have a sexual dysfunction because nighttime they have to get up to pass urine. Therefore, these are the symptoms which might be there for the patient with overactivity. And if how to evaluate this patient, the proper evaluation history taking to identify what is the exact cause for this overactivity, and based on that which we have to treat. Why this overactivity occurs? Why this overactivity occurs? Because normally what happens is when the urine fills in the bladder, but it has to reach particular level. Therefore, the brain sends a signal that it has to pass urine. Therefore, the bladder contracts and the muscle which prevents the urine to leak relaxes, then we pass urine. But in these conditions, this reflex pathway is affected. In somewhere, anywhere it can be affected. Usually, therefore, the brain inhibitory signal. Normally, brain prevents us the bladder activity to occur, which is affected. Therefore, what happens? Even the bladder gets filled for a limited amount. The patient has an urge to pass urine, and he has to go and pass urine. Otherwise, he will feel like he will leak and he will wet his underwear. Therefore, this is the basic concept why the overactivity occurs. If the patient has overactivity, first thing which we usually do is we just have a detailed examination and find out whether it is primarily overactivity or some other factors which predispose to overactivity. Second is basically we ask the patient to have a bladder diary. Therefore, we will know whether he has overactivity or he is because of this increased fluid intake, he is having increased frequency of micturition, or psychiatric factor is there which will affect the overactivity. Second, how to manage these people. First thing is you have to find out the etiology and you have to tackle the etiology. If the patient is having increased input of fluid, you have to restrict the input of fluid, you have to give him a dietary modification, and that's how we can find out the etiology. You can give a dietary modification. Next, you have to make the patient to understand that this is not a disease, it is just a symptom which can be corrected, which can be cured, or which can be modified. Second thing what you have to do is you have to find out the bladder diary, what is the cause for it, and how much time, how much fluid he takes, how much he passes, and when he passes. Second thing, lifestyle modification is most important factor in this. If the patient is having more diuretics, you might have to titrate the dosage, or you might have to change the fluid intake for him, and you have to ask the patient to avoid few things like caffeine, alcohol intake, tea, citrus fuels, and aerated drinks. This might induce this bladder activity. Second thing is you can advise the patient to double void. If the patient voids, you ask him to go out void after 5 minutes again. Therefore, he might have a complete feeling of complete emptying. Therefore, it can be prolonged. The duration of voiding can be prolonged. Second thing is timed voiding. You can ask the patient to visit the restroom even though he doesn't have a urge to pass urine at least 1 to 1.5 hours. Therefore, he will feel like he has completely emptied. He will not have this urge to pass urine. Second, you can train him to delay his voiding. That is, you ask him to, even though he has a tendency to urge to pass, ask him to hold for some time, maybe for a few minutes. Then slowly, when you train him, it may be increased to about half an hour to 45 minutes. This is other thing. Other thing is you can train his bladder muscles to contract. You can contract like biofeedback we can use, or you can ask them to do a pelvic floor exercises which will help to reduce this overactivity. And we have now good medications are available which we call as anti-muscarinic medication and beta agonists, which usually will help in patient which a physical modification or this bladder training doesn't help. Therefore, the medicine is just to support. Therefore, unless the patient does the physical modification and he trains himself, this medication may not help. Therefore, medication will help him to overcome the symptoms, which will prolong his voiding, and this urgency can be reduced. And these medications we give for about 3 to 6 months. But by the time the patient has to train himself to pass urine, and even in case of neurogenic bladder patients where this overactivity is very severe, we can give what is called as a biofeedback. We just stimulate the nerves, either tibial nerve, or we can fix some device in the back which will help to stimulate, which will help to decrease the overactivity. If this is not helping, then we can use what is Botox injection into the bladder to reduce the overactivity. Therefore, this conclusion, this bladder overactivity is not a disease. It's just a symptom complex which has to be properly identified and properly treated, which will help for the patient to alleviate his symptoms. Thank you very much.